I'd like to recognize the chairwoman of the Energy and Commerce Committee, Cathy McMorris Rodgers, for 5 minutes of questioning.
Much of your written testimony focused on CDC's response to the expected trifecta of respiratory diseases this season, influenza, RSV, and COVID-19, as well as your goal to rebuild trust. I hope CDC will learn the right lessons from COVID. I'm growing increasingly concerned about what we're hearing from China. The recent spike in respiratory diseases and clusters of pneumonia reported among children, images of hospitals and schools being overwhelmed with sick children. And it brings us back, sadly, to the early days of COVID-19. The lack of reliable information coming out of China is a troubling parallel to 2020. I, along with our Oversight Chair, Griffith, and Health Subcommittee Chair, Guthrie, sent a letter yesterday to CDC asking about what, if any, interaction the CDC has had with their Chinese counterparts regarding this outbreak. And I appreciate the email that CDC sent last night. I do want to urge you to respond to the letter completely and in a timely fashion, and understand we just sent it yesterday. While I look forward to your response, I'd like to know today whether the government of China has been transparent, forthcoming. Have you spoken with your public health counterparts there? Do you have confidence in their accuracy and completeness of the information that they're sharing? And do you have confidence in the independence of the World Health Organization and its ability to accurately share information out of China?
Well, thank you, Chairman Rodgers. First, just want to reiterate that based on the information we have now, we believe there is no new or novel pathogen, that these are related to existing pathogens, COVID, flu, RSV, pneumonia, and making sure that we are using our China CDC office. So we do have staff from CDC in touch with Chinese officials, our counterparts, and they have been in direct communication. They have shared, the Chinese officials have shared with us that, again, no novel pathogens, that what they're seeing is this. And we were able to corroborate that information across other sources from our European Union partners and others to make sure that we were getting a complete picture.
That's so important, because I have been concerned about CDC depending too much on official announcements from the government of China or the World Health Organization that has proven to be ineffective. I also think it's safe to say that the pandemic broke CDC's guidance drafting process. And leaving aside the disgrace of CDC's collusion with teachers' unions on the school reopening guidance, and the fact that CDC still won't tell this committee what outside groups it consults with when drafting guidance documents. Throughout the pandemic, the CDC struggled to produce timely, accurate guidance and had to regularly revise guidance documents within days of issuing them. The process is clearly broken. Do you believe doing something similar to what the FDA does, which is to use a clear, transparent process for how recommendations are crafted, disseminated, and applied, should be implemented at CDC?
Well, so first I want to say that we want to make sure that we are getting feedback, and I have already talked to our team about how we need to make sure that we are marrying evidence-based solutions with what works on the ground. As a state official, I want to make sure that the guidance that we are providing from CDC works for our states. Stakeholder engagement is a core component of what we need to do. Right now, we have guidance that is posted on our website for public feedback for all to do, but there are certain circumstances where we need to work quickly. Actually, the example of malaria that we responded to in Florida required us to move very rapidly and put out guidance for those communities in a rapid way. So
okay.
there
Thank
is.
you. Thank you. I have one more question I want to get to here. Because I do believe that this is fundamental, that we need good guidance practices. The FDA did this over 25 years ago. I have a bill that would require CDC to enact good guidance practices, and it even includes a provision allowing the secretary to waive those practices in an emergency. So unfortunately, the CDC is opposing this bill. So we've seen how CDC guidance can affect millions of American everyday lives, The FDA already uses a similar approach. Why shouldn't the CDC?
Well, I don't think there's a one-size-fits-all for the kind of guidance that CDC offers. Sometimes, like this example for malaria, it wasn't an emergency, but we did need to move quickly to prevent the emergency. Other times when we have the time, like we have right now, we have some guidance up on our website for feedback. I hear the intent of what you want, which is to make sure we're hearing feedback both from Congress and other stakeholders. It's very important to me as well. So we want to bake that in. I don't think there, like I said, there's a one-size-fits-all for that process, but I hear you on the intent and very much hope we're already showing you that we're fulfilling that.
Well, I want to work with you on this. I believe good guidance is really important, and it would go a long way toward building trust that has been broken. So I yield back.
Thank you.